My name is Dr.R and today is World Asthma Day. I'll be talking briefly on how to manage asthma, or if you're an asthmatic patient, how to manage asthma at home or that of your child to avoid coming to the emergency centers and diagnose COVID-19 patients, or avoid stepping out of your house to the emergency centers because of an attack. This is a trying period for asthmatic patients because if they contract COVID-19, it's really bad for them because of the state of their lungs, and they are afraid of stigmatization. I know how to feel. I have allergic rhinitis, and anytime I see someone stares at me, the stigmatization is just on the high side. So here we go. How do you help yourself to stay out of an attack as an asthmatic patient, or how do you help your child to stay out of attack? Number one, have an action plan. What's an action plan? An action plan is an individual plan set up by you and your healthcare provider to help you to control the symptoms of asthma or that of your child. It involves the drugs you will take, what you should do every day and what you shouldn't do, what you should stay away from. Number two, you must have a peak flow meter, or your child must have a peak flow meter. What's the peak flow meter? A peak flow meter is a handheld device that is used to measure your respiratory flow rate, or your ability to breathe out. This is what it's called. It's used to measure that. And now for it to be good, you have to blow in at least 3 times or 3 to 4 times in the day, and the best of your peak flow will be the one you have to maintain over time. Your best peak flow is the best out of those 3 to 4 times in the absence of symptoms of cough, difficulty in breathing. Now we use 3 lines or 3 signs, 3 markers, to know if you're doing very well or not. Number 1 is green. Green is when you're doing very well. You're out of the symptoms of cough, difficulty in breathing. You're taking your long-term medications, and you have a good peak flow. Like you have the best of your peak flow and you're maintaining it. Then if you're yellow is a warning sign, which means that you have gone below your best flow, your best peak flow, and you should have a quick relief medication besides your long-term medication. And number 3, which is the danger sign, that's the red, it shows that you have gone way less than half of your peak flow, and with your quick relief medications and even your long-term medications, you're still not getting relief, or you've been having the yellow marker for more than for 24 hours and more, which means you need to run to the emergency center. You're having asthmatic attack. That's number 1, to know how to control the symptoms of asthma with the help of the peak flow. Then number 3, you need to have your medications handy. You have your bronchodilators, your glucocorticoids. You need to have your medications close to you. Those are the medications that are given to you by your doctor. Then the last but not the least, and the most important, you need to stay away from your triggers. What are triggers? Things that upset you, or the allergy, things that upset or start the allergy and then make you to have the difficulty in breathing. For example, are you allergic to dust? You need to stay away from dust. All those allergens, you need to stay away from them. Once you do that, you will be able to control your asthma and avoid the emergency centers. Remember, have an action plan. A good action plan will help you to control these asthmatic symptoms. Number 2, you have your medications handy. Number 3, you have a peak flow meter for you or your child, if it's a child that is suffering. Number 4, know your triggers, know your allergies, and stay away from them. Thank you very much and have a great evening. Good night.